Hey guys, Dr. Dane here. So today we're going to talk about something that's super common that I see all the time in the office. And it's something called seborrheic dermatitis, or better yet, dandruff. And it can be anywhere on the scalp, on the face, and on the rest of the body. And today we're going to talk about what it is and how we can treat this condition that's so common. If you're new to the channel, I'd love for you to hit that subscribe button and comment below any questions you have about any skin issues so I can make a future video on it. So let's get right into it. Seborrheic dermatitis is caused by a yeast called Malassezia or Pitiosporum. And the etiology of it's not really well understood about why, who gets it and what, but there's a couple things that we do know. It's super common. Up to 5% of the population has it, and it can present in many different ways. Stress is a huge factor for it, and certain conditions such as immunosuppression. Some people that even have neurologic disorders such as Parkinson's or other neurologic disorders can get this pretty bad too, or even advanced cases of dementia. But what is seborrheic dermatitis and how can you spot it on the body? Oftentimes you may notice you have some dry scalp or some flaking. That's the most common. And that's why shampoos like Head and Shoulder and Selsun Blue are so commonly sold, is because it's a very, very prevalent condition that people have. But you can also get it in other forms. You can get it in between your eyebrows where you get red, flakiness, and oftentimes it's in the T-zone or the areas that are rich in sebaceous glands that secrete that oil, that sebum. You can get it in between your eyebrows, underneath your eyebrows, very common around the nose, around the mouth, and especially when guys you're shaving, you may notice you get a flare-up with that too. Sometimes other conditions, change of season, can flare it up too. But there's unfortunately no cure for it, but there's a lot of good things that we can do to help control it. You can even get it in your chest, even in the groin area can be there as well. Common treatments are going to be starting with shampoos, such as Neutrogena T-Cell or T-Gel, or Selsun Blue, or Head and Shoulders. I like their clinical strength. Or if that's not really doing the trick, you can always use a prescription shampoo such as ketoconazole or cycloprox shampoo. And ideally you want to wash at least 3 days a week or more if you're going to be in the shower. In addition, your doctor may prescribe for you a topical steroid lotion or a solution that you can put into your scalp if it's in the scalp area to help with reduce the itching, because sometimes this can be very itching, and it can also help reduce some of that inflammation there. In addition, we also like to prescribe an antifungal cream that you could use in the affected areas as well. Finally, if those aren't really doing the trick, sometimes we can prescribe other creams such as topical calcineurin inhibitors that can really help reduce that inflammation, and sometimes even topical steroids in short doses and short periods of time will help significantly as well. One more thing, it's not very unlikely to have an overlap of something called psoriasis in your scalp with this condition, seborrheic dermatitis. So sometimes it's on a spectrum where you may have just a little bit of dandruff, and then maybe years later down the road you start getting these thick scaly plaques in your scalp, and it's actually have now become psoriasis, or it's transitioned, or even in the beginning you may have had scalp psoriasis all the way along. So it's really important to see your dermatologist to help make that distinction, because the treatments are a little bit different with that scenario. So guys, if you feel like you've had any of these symptoms like on your scalp or your face as we described earlier, just go ahead and contact your dermatologist or comment down below, leave me a question, and I'd be happy to get back to you. And if you have any other ideas for a future video you'd like me to shoot about a skin topic that you'd like to discuss, just let us know, and hit that subscribe button so you'll be notified as soon as we make another video. Till next time guys, take care.